First of all, the big problem is that alpha-1 antitrypsin deficiency is a very rare disease. So that means that in everyday life, most people don't even think about it. So that's the biggest problem. The advantage of alpha-1 antitrypsin deficiency is that the diagnosis is actually simple once you think about it. So really the first message is you have to think about it with any patient who has any basically lung or liver problems, especially if there is kind of a family history, then think about it, and the rest is basically a piece of cake. So the diagnosis is done. It's a two-step diagnosis. Typically, once it's a simple serum blood test or blood test, where you measure the alpha-1 antitrypsin level, and if it's decreased, then you go for the specific diagnosis, which is either genetic or kind of protein phenotyping, so to see whether this is altered. Alpha-1 antitrypsin deficiency is a disease which affects both lung and liver. That means that you need to somehow know how does the lung and liver look like. When you have a severe alpha-1 antitrypsin deficiency, you are about 20 times more likely to develop advanced liver disease. So you need to test for that. For liver disease, the number one kind of prognostic feature is the amount of liver scarring, which is also called liver fibrosis. And the gold standard for liver fibrosis is still a liver biopsy, which is not that accurate, and it's painful. So that's the two things which are not making it particularly attractive. It's probably even less attractive in patients with inherited disease. That means that you basically have to watch for the liver disease their whole life. So usually you can convince a person to do one liver biopsy, but you cannot convince anybody to do liver biopsy every 5 years. So kind of liver biopsy is really out of question for long-term monitoring of patients with inherited conditions. So then, if this is out of the question, probably the best tool at the moment is a specialized ultrasound. This is called transient elastography. There are also other elastographic techniques, and in that case, you basically measure the stiffness of the liver, and the more scarring you have in the liver, the stiffer the liver is, and the less scarring you have. So basically, a healthy liver is soft as a nice cake, and a very sick liver is hard as a rock. Basically, that's how you can say that. Other than that, there are all kinds of blood or serum-based parameters that you can measure also as a surrogate of liver fibrosis. For one antitrypsin deficiency, you have basically two key things that you want to understand. One is the fibrosis that we already spoke about, which is basically of interest for any liver disease. And then the second part, which is interesting, is basically specific for alpha-1 antitrypsin deficiency. So alpha-1 antitrypsin deficiency is caused by a mutation in alpha-1 antitrypsin gene, which means that this protein, which is otherwise secreted, is altered due to inherited mutation, and it gets stuck in the liver. So you get some kind of accumulation of this alpha-1 antitrypsin in the liver, and this is the specific feature of this particular disease. So apart from trying to understand the liver fibrosis, we wanted to understand the process of alpha-1 antitrypsin accumulation in the liver, and whether any of the non-invasive features can actually measure this accumulation process. As mentioned before, we focused on predicting the two things. One is the fibrosis, which is kind of the scarring process. And here we basically saw that the markers that are known in other disorders seem to apply relatively well for alpha-1 antitrypsin deficiency as well. So this liver stiffness measurement, this specialized ultrasound, as we discussed, seems to be a particular good biomarker. And there are some other biomarkers which are either related to a liver injury itself, like for example APRE, or parameters of the scarring process, like PROCES3, which is a part of collagen, which means some of the extracellular matrix proteins. So these seem to be relatively nicely reflecting the fibrosis process, which is very reminiscent on other liver diseases. The other part is, as we said, more specific to alpha-1 antitrypsin deficiency, and it relates to the accumulation of the alpha-1 antitrypsin in the liver. And here we see that measuring the serum levels of the mutated alpha-1 antitrypsin seems to be a useful surrogate to know what's going on in the liver. This is a new piece of information, and also basically made possible by the recent developments where we are now able to measure more specifically the mutated protein, which is important because some of these patients actually receive an augmentation therapy, which means an addition of human purified alpha-1 antitrypsin, and this makes it important to recognize actually the endogenous protein from the edit protein, and this is a development which actually came forward during the drug development studies. The whole efforts we are focusing here on are basically coming from phase 2 clinical trials that studied this complicated drug named Fazirsiran and their effects. So Fazirsiran is one of a relatively new class of drugs. It's called siRNA. So these are drugs which block a production of a specific target gene, and they don't work on the genetic level, so not on the DNA level, but they work one level below that on the RNA level, which has several advantages, especially if you don't go directly to the gene, and then you cannot make some genetic alterations that can be kind of cancer promoting and so on. So it's working on the short-lived copy of DNA, and because of that probably has less of these dreaded side effects like genotoxicity and so on. So Fazirsiran is blocking the production of the alpha-1 antitrypsin, which is particularly meaningful in the alpha-1 antitrypsin deficiency because the liver disease originates from the fact that this mutated protein is not secreted from the liver, and because of that is actively causing harm. That's why we call it also a prototoxic liver disease. That means a disease that is directly caused by accumulation of unwanted protein, and vice versa, blocking the production of this protein is thought to be beneficial, and the phase 2 trials actually show that this is the case. So on one hand, it shows that we are really very efficiently able to block the production of the alpha-1 antitrypsin protein, so we are able to decrease it by 85 or even 90%. And there are also clear data showing that this blockage is associated with improved signs of liver injury, such as serum liver enzyme levels or also histological signs of liver injury.